So HIFU stands for high intensity focused ultrasound, which is sort of a fancy way of saying we use ultrasound waves to destroy prostatic cancer cells. There's a couple reasons why I like it. First, it's a little less invasive than the traditional operations, which also provides a little less risk. What's essentially involved is outpatient procedure where a patient would come in, you would get a general anesthetic typically so that you'd be asleep and wouldn't recall any of the procedure. Then utilizing an ultrasound, we would visualize the prostate, and then I like to say we focus the ultrasound sort of how you would focus a magnifying glass. So if you remember as a kid, maybe you tried to burn a leaf or something like that, and you could pass your hand in between the magnifying glass and the actual hot spot. And that's how HIFU essentially works. Basically, an ultrasound inside a specialized machine focuses a beam of sound energy at one particular spot in the prostate and can get it very hot and burn it, but protecting the other tissues around it in a similar fashion of that magnifying glass. And by changing the focus point of where we center that ultrasound energy, we can slowly destroy cancer cells while leaving the other tissue intact. The big advantage, obviously, is one, no incisions, but two, using the ultrasound, we can see sort of on a more granular level all the important structures, most importantly the nerve bundles and what's called the urinary sphincter. Injury to either of those two structures are responsible for the more classic or unfortunate outcomes from traditional procedures, namely erectile dysfunction and urinary incontinence. But by utilizing the ultrasound imaging, we can find those structures in real time and avoid them during the procedure. Part of the big problem with prostate cancer is most of the treatments have significant side effects. And men are often concerned about their loss of erectile function, which can damage their sexual life and the relationship with their partner. One of the reasons why I like HIFU for certain select patients is that it allows us to identify the nerve bundles. Those are the ones that control the erections, and then by avoiding them with the energy, we can preserve erectile function in the vast majority of patients who undergo this procedure. So an outpatient procedure technically is just a procedure where you don't have to stay overnight in a hospital. The procedure is a few hours long, but typically there's not a lot of side effects or pain afterwards. So men will often have a catheter, which is a small tube in the bladder, after the procedure for a week or two, so that will limit their activities. But in terms of overall pain or anything, usually there's no pain, there's no incisional pain, and men are back to their normal activities or can return to work within a few days. The most appropriate candidate to me would be someone with a low risk or intermediate prostate cancer, or even better, somebody who at this stage may be considering what we call active surveillance, not doing anything, but is concerned about the potential for progression. This provides a nice opportunity or a nice procedure to have the peace of mind of knowing that the cancer has been treated without having to go through the worry of wondering if it's ever going to progress.